Yay! Hi guys! Yes, it's another Saturday night, so it's vibe time. Again, hindi ko alam kung narinig ko kung may echo, but anyway, welcome to another night of chill conversation, something we definitely need, especially in these trying times. Join us and maybe you'll be able to pick up a new thing or two from our show. Ako po si Alren ng Stream Siomai Live, and this is KaTalk. Ay, binalik yung echo. We are live sa ating Facebook page na Stream Siomai. For those who have liked and followed our page, maraming salamat. For those who haven't, you can still like us. You can either search us via the URL, facebook.com/streamsiomai live, or you can just hover your cursor dun sa ating DP and click the like button. You can also press follow so that you'll get a notification, especially when we are about to go live. So please feel free to drop a comment or a question to our guest and we'll do our best para mabasa at masagot ang inyong katanungan kung meron man. Before ko i-introduce yung ating guest for tonight, I just wanna mention na KaTalk Highlight is available on Facebook and Instagram na rin. So for those na hindi bet yung quality ng Facebook, kasi usually di ba pag nag-start i-play yung video, hindi maganda yung resolution agad ng Facebook. So if you want to opt for a higher resolution or ng video, you can always check it sa Instagram via IGTV. So, yes, it's all there. Watch nyo na lang when you can. The second to the last part was already released an hour ago. So, tomorrow may last part pa dun sa KaTalk Highlights with Direct Ram Tolentino. So, yes, tapos na ating first and second episode. Let's proceed to our third guest for tonight. So, okay, medyo masaya and challenging at the same time. It's because first time akong makikipag-interview with someone na, yun nga, well, last time was about, yun nga, yung guest na hindi ko kilala in person. This time, it's someone naman from a different industry. So, bear with me if may mga questions ako dito na feeling ko, well, I did, sabi nga ni Ms. Cara David, do your homework. So, as much as possible, wag kang papasok sa interview kung hindi ka gumawa ng research. And thankful naman ako kasi nag-provide siya ng information sa atin maliban sa kung ano lang yung parang impressions natin or general impressions as a person who's not really into that field. So, before natin siya ipakilala, eto, may konting background lang tayo tungkol sa kanya. Ay, magbabasa ulit tayo. But yes, makakatulong to sa, makakatulong talaga sa atin to in our coming discussion. So, isa siyang physical therapist based in California, USA lang naman. Isa siyang board-certified clinical specialist in geriatric physical therapy. Ay, jargon, charot. So, and is currently pursuing his doctor in physical therapy degree sa University of Montana. He is a host, so nagpa-produce din siya ng podcast. It's called PT Meal, Physical Therapy Podcast, na nakalink sa ating caption. So, if you're curious kung ano yung ginagawa niya, ano yung pinoproduce ng podcast, please feel free to like his page. So, yun yeah, it's a program on anything about physical therapy profession and practice, from practice settings, specializations, advocacies, and certain conditions. Inaanyayahan niya ang mga Filipino PTs from around the world para pag-usapan ang kanilang stories, kanyang karanasan, at yung kanilang expertise sa kanilang audience. This time, however, since personally, I'm not really an adept when it comes to this field. It's like I'm a student for tonight. So, PT 101 talaga tayo for tonight. So, without further ado, ipapakilala na natin ang ating guest for tonight. Walang iba kung hindi si Johann Dela Paz. So, hello! Good evening, Johann.
Hi, good evening.
Actually, good morning. Yes, good morning.
Yeah,
all
good
the
morning.
all the way from California. Good morning. So, yes, kumusta ka naman?
Ayos lang. Thank you for inviting me. Glad to be here.
Ayan, sige. Simulan na natin yung ating chill na usapan. So,
Sige.
curious kasi we have people na ako sa industry ko na syempre meron akong stories kung paano na ano yung nag-inspire sa akin to push through with the field that I am currently in. Can you tell us your story?
Mhm.
Kung paano ka nagsimula, kung bakit ito yung napili mong industry and field of expertise. Go ahead.
Okay. Kasi nung high school ako, hindi ko alam kung ano yung gusto kong kunin. Actually, wala akong idea. Parang sabi ko, ano yung mga ginagawa ng mga tao around me. So, yung parents ko, my dad is in chemical something. Tapos my mom was a CPA pero real estate. Tapos my sister was in nursing. So sabi ko ayoko mag-engineering, which were all my like, uncles and my dad and my grandfather. Tapos my mom was CPA, so sabi ko magaling naman ako sa numbers back then. So sabi ko sige, accountancy pwede. Tapos nursing, sabi ko parang hindi naman, ayoko ng dugo. So sabi na ate ko, try mo naman mag physical therapy. So dalawa lang yung kinuhanan ko ng exam sa college, UST tsaka UP. And I wasn't sure na makapasok sa UP. So sa UST, kinuha ko, first choice ko accountancy, second choice ko physical therapy. So pumasa ako pareho. Tapos hindi ako umabot doon sa cut-off deadline ng pag-enroll sa accountancy. So sabi ko kailangan makapasok ako sa physical therapy. Yung physical therapy kailangan mayroon pang interview bago ka makapasok doon sa program. Tapos ayun, tinanong nila ako bakit magkaiba yung pinili kong industry, bakit isa business, isa sa healthcare. Tapos sabi ko lang, para kung hindi ako pasok doon sa isa, pwede ako doon sa kabila. So ayun. So natuwa naman ako, nakapasa ako sa physical therapy. Tapos parang kada natututunan ko yung physical therapy as I go on sa coursework. Parang na-appreciate ko na siya hanggang maging nandun na ako sa major subjects. Mas na-appreciate ko na yung ginagawa ng isang physical therapist. So yun, medyo ang dami ko sinabi. Pero yun yung story bakit ko napili yung physical therapy.
I see. Yeah, I mean, of course, tayo naman meron tayong sariling stories sa college, ganyan. Kwentuhan mo naman ako ng unforgettable kwentuhan mo naman ako ng unforgettable experience, pwedeng certain subject, certain professor na hindi mo makakalimutan na hanggang ngayon dala-dala mo pa rin siya habang ginagawa mo yung profession mo.
Unforgettable experience. Ano ba to? Yung medyo heartwarming ba to? Medyo malungkot na
It's up to you. Pwedeng both if you want.
Hindi ko lang naman makakalimutan sa PT life ko noon at one time naging active ako sa organizations. Parang second year pa lang ako, active na ako sa this organization, Pax Romana. It's a religious organization. So kami nag-organize ng hindi man organize pero nag-handle ng mga Eucharistic celebrations, mga confirmation, mga ganyan. So parang dati sabi ko nung pagpasok ko ng college, sabi ko sarili ko hindi na ako mag-active sa mga ganyan kasi parang mahirap na yung college, iba yung scene pag sa high school ka na marami kang extracurricular, tapos college, tapos marami kang ginagawa. So parang yung kinakatakutan ko, parang napabayaan ko yung studies ko nung nag-focus ako masyado sa sa organization. Tapos ayun, uh, ang pinaka-highlight siguro ng PT student life ko ay yung tawag dito, na-delay ako sa school. Ibig sabihin, bumagsak ako ng isang subject. Pag sa physical therapy school ka, hindi ka pwede mag-summer, lalo na pag major subjects. Tapos, sobrang laking sobrang laking deal sa akin nun kasi never akong bumagsak from grade school to high school. Lagi ako nasa top nun eh. So parang sobrang bagong feeling sa akin. Ayun. So after so na-delay ako ng 1 year, meron akong SEM na yun lang na subject na yun ang tinitake ko. Tapos hindi ko na-take yung mga prerequisites and stuff like that. So ang ginawa ko doon sa time na yun, dahil uso back then, nag-call center ako for that summer and for that semester. So yun, so marami akong natutunan, life lessons doon sa experience na yun. Pero mas na-appreciate ko yung student life as a physical therapy student and college student doon sa experience na yun. So mas nahimay ako, nabigyan ako ng time to concentrate on certain subjects na siguro I find na mas mahihirapan ako kung hindi siya naging separate from other subjects. So I guess yung experience na yon during that time taught me to to take care of yourself, don't take things for granted, tapos and like yung napag-usapan rin namin to sa podcast na life is not a race, do it at your own pace. I was talking to a guest before na ganun nga, so he don't get frustrated kung yung mga classmates mo graduate na ahead of you, kasi at the end of it, if you become a physical therapist and pass your license, no one would ask you, ilang years mo ba tinik yan? Saan school ka ba galing? Kasi we're all the same na after you get your license. And you just have to prove yourself to your patients and not to anyone else na. So I guess hindi siya physical therapy per se, pero yun yung, I guess, life lesson and memorable experience ko ng college. Pero ngayon naisip ko na, pero marami na-appreciate ko yung mga professors ko back then. They really taught us well, prepared us to become the best physical therapist that we can be. So yun.
I see. Ano ba yung pwede? Nag-isip lang pwedeng itanong. Hindi, ganito. Curious kasi ako kung ano yung parang mga pinagdaanan mo experiences before eventually landing to what you or to where you are right now. Pwedeng without mentioning names or dahil alam mo naman NDA. So I know there are parts that can't be mentioned in public or in live. So kwento mo naman sa amin kung ano yung mga experiences mo as you go through your career and to where you are now.
Okay. After college, parang wala akong idea kung saan ako pupunta. May at the back of my mind, sabi ko gusto ko mag-specialize on something sa Philippines, pero naisip ko din gusto ko mag-US. So, marami kong options na iniisip, pero wala talagang concrete plans. So sabi ko, sige, let's try making a career here, see where it goes, and tingnan lang natin yung option na US kung pag dumating na tayo doon, kung wala talaga. So I worked in the Philippines mga 5 years. Tama ba? No, 7 years. I graduated 2009. Tapos umalis ako 2016. So that's 7 years. Almost 7 years ako nasa Philippines. So yung journey ko doon, parang I've been to different companies eh. When I started as a volunteer physical therapist, Tapos, naging contractual in one hospital. Tapos, syempre, pag contractual ka, hindi ka pwedeng tumagal ng how many months you have to go. Tapos, nakakuha ako ng isang work. Tapos, dun sa isang outpatient na yun, na-enjoy ko naman. Na-enjoy ko yung mga patients, yung experience, yung mga katrabaho ko. Then, sabi ko sa sarili ko, parang I want to do something more or something else. So, doon pumasok sa isip ko yun, sige, pwede kong mag-masters. Pero, pero inisip ko rin, para saan? Wala naman, hindi ko naman bala magturo. Then I realized, sabi ko nga sa sarili ko, magandang maraming options. So, dumagdag yung teaching sa isa pang option. So I got my master's. I enrolled in a master's program sa UP, CHK. Tapos maganda naman yung experience kasi I had classmates from different fields. Dun sa program na yon sa Human Movement Science, marami akong classmate na sports science graduates, physical education graduates. Sila yung mga PE teachers, mga working with sports teams. Tapos ako, physical therapist dun sa class na yon. Sabi ko, bago yung experience. Ang dami ko natutunan sa kanila as well as dun sa professors. So, parang like what you're doing na iba ako sa industry mo. Parang marami rin ako natutunan sa experience nila being in that program. Tapos, I transferred to a different company ulit. Medyo closer to where my mom was staying back then sa Laguna. Kasi maganda din yung experience. Hospital naman siya. Iba na naman yung mga kasama ko and very fun naman. Laging namang pag-rehab team, medyo close-knit kasi yung mga ganun close-knit team siya kasi we work together, occupational therapist, physical therapist. So yun, masaya naman yung experience. Then I graduated from my master's. Tapos at that time, inuunti-unti ko na yung pag-aralan kung paano ako makakapunta ng US. Kasi sa US requirements, mga hinahanap nila at that time is master's level or as long as your curriculum is same or similar to that of the US graduates. So yun, may mga agencies na ako nakanausap. Meron akong napuntahan first na agency na very excited ako. Sabi ko, ito na yun. Nilakad ko na yung mga papeles ko. Tapos ang nangyari, hindi pala sila magtutuloy na mag-send ng physical therapist kasi mas sanay sila sa mga teachers. So napurnada yung first attempt ko sa pagpunta sa US. Tapos may nag-refer sa akin dun sa next na agency ko na for deployment. Ayun. Nabigyan nila ako ng timeline, tapos set na yung date for my exam for US. Tapos, after 2 years of signing up with them, nakaalis ako. So, while waiting for that time ng exam to the deployment, nag-work ako sa isang government hospital, military hospital. Then, masaya din naman. As I've said, close-knit yung mga rehab team. Tapos, nag-part-time din ako mag-teach sa university. So, parang yung options na binukas ko for myself, nagamit ko naman eventually. So, kaya nga yung mga advice ko sa ibang mga physical therapist or students ay keep your options open. Just open doors for yourself na pwede mo magamit in the future. Kasi hindi mo you can plan for things to happen, pero some things you can't control. So, at least meron kang backup plan pag yung mga nangyaring hindi mo nakikita. So yun. So everything worked out well. Tapos yun, pagdating ko na dito, nag-start na yung contract ko and stuff. Tapos maganda kasi yung contract ko then kasi if you do more work, bibilis yung contract mo eh. I don't think they do that anymore. So napabilis yung tapos ng contract ko, na-absorb ako ng company, tapos I decided to move here sa California and look for job here kasi I'm closer to my relatives here in California than where I was, which was in Maryland. So yun, yun ang journey ko sa aking career from graduation till now.
Mhm. Yun nga, nakwento mo nga yung experiences mo from working here in the Philippines and working there in the United States. Maaari mo bang i-share sa amin yung work environment, yung kahit yun ano na lang, yung parang generic or parang paano mo siya i-summarize in general, yung work environment there, and how is it different from the working environment that you experienced here in the country?
May mga similarities, meron din naman differences. Siguro yung similarities niya, since you're in a rehab team, yung physical therapist, occupational therapist, sometimes merong speech language pathologist. So mas you talk amongst your peers. Kunwari you share your patients, same as in the Philippines. Kunwari meron kaming parehong pasyente ng OT, pag-usapan namin kung ano yung ginagawa nila, ano yung ginagawa namin, paano namin matutulungan yung patients sa ma-achieve yung goals nila. Siguro yon, one, collaboration, similar. Siguro two, siguro work-wise, same din kasi basically ang goal naman ng physical therapist is to make their patients better eh. So I guess wala siyang hindi siya ganun ka different kung anong ginagawa namin sa Philippines sa ginagawa namin dito. Siguro ang main difference sa Philippines, hindi masyadong required ang documentation. Ewan ko ngayon pero before nung nagtatrabaho ako, you document your findings, you document what you did with your patients, but that's just for your eyes only in the medical team, rehab team. Hindi siya nakikita ng payors or ng insurance. Dito sa US, you document because of insurance. Kailangan nakikita ng payors kung sino magbabayad ng treatment, kung ano na ba yung goals na na-achieve ng patients. Kasi ang tanong nila, bakit pa kinikita yung patient for physical therapy kung wala namang nangyayari or kung hindi naman talaga kailangan ng physical therapist. So here, you really have to prove your worth. You have to prove that your treatment is necessary. You have to prove that your treatment is working, so to speak, either for a rehabilitation standpoint or a maintenance standpoint. Tapos, you have to prove that it's a skilled treatment, meaning only a physical therapist can provide. So yun ang major difference na kailangan naming matutunan kung magtatrabaho kami in the US, insurance and documentation. Second is, here, different settings eh. Sa Philippines, alam lang natin usually is hospital and outpatient. Tapos, yung mga ilan na matatapang nag-home care. Dito, maraming settings na pwedeng pagtrabaho aside from home health and hospital and outpatient. Meron kang skilled nursing facilities, meron kang independent living or assisted living facilities, meron kang emergency care, tapos yung outpatient mo, iba-iba rin. So, depende kung saan ka mag-work na setting dito sa US. Some of them similar lang din ang practice sa Philippines. Some are somewhat different in terms of what your goals are and what your um, team would make up. So yun, I guess yun yung mga similarities and differences ng practice. Pero pag may nagtatanong sa akin kung malaki ba yung pinagkaiba, I would say hindi masyado. You just have to learn policies and procedures na unique to the state and to the whole practice, like the federal level. So insurance, yan, mga ganon. But basically the same.
Ayan, so napag-usapan na nga natin yung career journey mo, yung mga pinagdaanan mo. Hindi pa natin na-define talaga ang physical therapy. Like, yun nga. I think may mga viewers tayo dito. Shoutout na din pala actually sa mga 10 viewers natin. So thank you so much for watching. Si Jane Claire Bola. Oy friend, hi friend. Jane Claire Bolahan watching from Laguna. At si Elizabeth Kamua Ganotisi. Please correct me if I'm wrong kung mali ang aking pagpigkas. Watching from Bulacan, Philippines. Thank you for watching guys. So yun na nga. I'm sure may mga...
Tibet.
Oh! Ay, nice. Hello po. Maraming salamat po sa panonood sa atin. Yun nga, may mga, ako, personally, I'm not really an adept when it comes to the industry. So, make it as simple, or siguro in layman's terms, how would you define physical therapy?
Okay, so, I guess, ang pinakamadaling explain ng physical therapy ay physical therapy aims to maximize a person's movement or function. So, kung ano man yung level ng kakayahan nila ngayon, sa physical therapy, gusto namin yung palakasin, pagbutihin, ano ba? Paigtingin. So, keso you're a healthy individual, keso meron kang condition or meron kang injury, gusto ka naming palakasin more than what you have right now. So I guess yun yung pinaka simple term ng physical therapy.
I see. So the reason I asked that is because we're going to elaborate that further. Pero bibitinin muna natin yung ating kwentuhan for tonight. Dahil yun nga, marami pa nga tayong pag-uusapan. So please wag muna kayo mag-exit. Time check muna tayo. It's 10:27 p.m. And kasama pa rin natin si Johann Dela Paz for tonight sa ating episode na KaTalk. Pagbabalik tayo after 5 minutes. Again, 10:27, 38, 29, 30, 31, 32. 10:32 magbabalik tayo in 5 minutes. So, dyan lang kayo and we'll be back. Alright, hi guys. So, nagbabalik ang inyong kakwentuhan at katsikahan on a chill Saturday night. Kami, ang inyong KaTalk. Again, hindi ko alam kung gumana yung echo. Anyway, kasama pa rin natin si Johann Dela Paz of PT Meals, isang physical therapist na nasa California, USFA. Siningit talaga. Anyway, babalik na tayo sa ating conversation. So, earlier, yun nga, dinefine natin yung physical therapy. And this is a part where we are going to elaborate it further. So, bakit importante ang physical therapy to someone na parang, syempre, lately we've heard these video sentiments as even from professionals of this, nakapareho nyo na industry na parang masamasahe lang naman daw ang ginagawa ng isang physical therapist. So, bakit pa ako a-attend ng session ng isang PT wherein pwede naman sa masahista? Yung mga ganun, like, more on the misconceptions and yan. So, can you tell us more about it? I'm sorry. I think we have a technical difficulty. So, double check lang po natin. I think your mic is on mute.
Ako nga, sorry.
Yan, it's okay.
So yun, sige, puntahan natin yung unang question na bakit importante yung physical therapy. I guess yung role ng physical therapist ay importante kasi physical therapist would um, evaluate, analyze, assess the things that you lack and the things that you have currently so that they can help you improve on those and maximize what you have so that you can, reach the goals that you set for yourself. So, what parang ang hirap kasi explain pag you have to prove yourself, Pero yun nga, we provide the skills, the knowledge para ma-facilitate yung recovery and rehabilitation ng isang tao in terms of their physical function. So, mga taong na-stroke, mga taong nagkaroon ng heart attack, mga taong nagkaroon ng sports injuries, mga taong gusto maging healthy. So, pwede kami pumasok in those areas to guide them safely to their goals. Kasi we know or we have the knowledge kung paano namin siya magagawa ng maayos at ligtas at wasto. No? Hindi lang yung eto, exercise ka, eto na yon. So, yung inaral namin for 5 years, 6 years for me, pero 4 years na ngayon dahil sa K-12 na curriculum. So, yung inaral namin for that time, doon namin ina-apply yun from anatomy to physiology, kinesiology, to medical and surgical conditions, whether muscle, skeleton, cardiac, pulmonary, or lungs, or kahit ano pang system, nervous system. So yun, inaral namin lahat yon, and we focus on rehabilitation. So isipin nyo, background namin is parang doctors that study different kinds of diseases and conditions, pero ang focus namin ay rehabilitation and recovery of a patient. So yun, yun ang importance ng physical therapy. So pasok naman tayo dun sa isang question mo about the misconception na physical therapist ay masahista. Common siya kasi I would say na not all people would have an idea what a physical therapist is and what they do. So, massage is one component or one small component or tool na ginagamit ng isang physical therapist sa kanilang treatment. Hindi naman talaga exclusive ang massage to any profession, and not just for massage therapists, but ginagamit din namin siya for not treatment but as an adjunct, meaning pwedeng panguna, pwedeng panghuli, or ano ba panggitna, adjunct lang siya or complementary lang siya doon sa ginagawa namin. Pero ang focus talaga namin is to movement kasi yun ang end goal mapagalaw yung pasyente. So siguro mas tumatatak sa pasyente yung or doon sa ibang tao yung masahe kasi some of the physical therapists are really hands-on. So naiisip siguro nila that doon nga kakala nila masahe lang talaga yung ginagawa ng physical therapy. Pero hindi. Ang focus ng physical therapist ay to movement, to exercises and activities that would help you reach your goal. Ang isa pang misconception or sabihin nila, bakit pa kami pumunta sa physical therapist kung exercise din naman? Pwede naman kami pumunta sa gym lang at mag-exercise, di ba? Or pwede naman kami kumuha ng personal trainer lang, or I don't want to say lang, pero personal trainer or other people na magtuturo sa mag-exercise. for people, especially with certain conditions, it's best to seek medical help so that we can, like us, like physical therapists, doctors, and physical therapists, guide you to your rehabilitation safely. We don't want you to get hurt doing exercises, and we don't want you to aggravate yourself doing exercises that may not be appropriate for you or safe for you. So, magandang you see a physical therapist, your doctor, then your sa Philippines, you see your doctor first, i-refer ka sa physical therapist to help with your rehabilitation. And once the physical therapist say na, okay, you're safe to return to your normal or usual physical activity or your exercises outside, the gym, or you want to go to the gym or your community, then pwede na. So parang sa amin, parang ano lang kami, parang gatekeepers to saying na these are the things that are safe for you now, and when you're done and you graduate from that, okay, we'll let you out to go to the world na eto na, you can do things on your own, and these are the things that you can safely do, and this is how you progress your recovery. Kasi hindi naman namin, ayaw din naman namin na magtagal kayo sa amin for a long time eh. Kami yung, mga sinasabi ko nga sa pasyente namin eh, as much as we want to see you often, we're the kind of medical professionals that don't want to see you. Parang gano'n. Gusto namin hindi ka namin makita. Gusto namin magaling ka, gusto namin malakas ka, at nasa community ka. Ayaw namin na nagsistay ka lang sa amin. Kasi we're not doing our job kung napakatagal mo na kinikita ang isang physical therapist. So, I guess, yan, mas na-instill sa akin, yung ganong idea dito sa US na if I'm seeing you for this long, it means I'm not doing my job. I should be able to discharge you, and you should be able to do stuff on your own as fast as you can. Kasi nga, nandito ako para tulungan kang ma-achieve yun. So, yun. So, I guess that's why physical therapy and physical therapists are important. And I guess I've tackled some of the misconceptions of physical therapist na naririnig namin as physical therapist. I think marami pa rin naman.
I see. Yun. Actually, yung friend ko, meron siyang shinare na question dito. Pero, before I proceed to her question, I have this question. And yun din, I'm not sure if this is a valid question. Pero, is it some sort of a requirement, let's say for a person or for a patient for this matter, na gusto niyang umattend ng session to a physical therapist, kailangan ba muna niyang dumaan sa doktor, or parang kailangan ba merong recommendation ng doktor before ka mag-proceed sa physical therapist, or is it possible to just proceed to the physical therapist? Like, do they complement each other, or how do they differ from each other?
Okay, magkaiba kasi yung practice ng Philippines sa US. So, I'll go sa Philippines. Sa Philippines, the law would say na you have to see your doctor, any doctor first, before you get to be referred to a physical therapist. So, yun yung nasa batas. Wala pang direct, we call that direct access eh. Wala pang direct access law sa Philippines na nagsasabi na pwede kang dumiretso sa physical therapist if you have any problem. So, you have to go to your doctor first. So, yun yung chain of command sa Philippines right now. Go to your doctor first. Say your complaint. Ano yung nararamdaman mo? May masakit ba? Or did you undergo any... and after surgery, usually talaga nakikita mo yung doctor eh. So, wala ka ng problema doon. But if you have any complaint, muscle pain, skeletal pain, ganon, you go to your doctor first. Then the doctor would refer you to a physical therapist if you need that. If hindi, at you feel na you'll benefit from physical therapy evaluation, then you tell that to your doctor, and I think they would gladly refer you to physical therapist. So yon, so that's the practice in the Philippines. Ang practice naman dito sa US, there are states here na patients can or people can go directly to physical therapist. So kunwari may masakit sa kanila or may naramdaman sila, pwede silang dumiretso sa physical therapist. Again, different states would have different rules, pero most states would have that. May direct access rule na sila. So, yung iba dito, kunwari, nakakita na ng physical therapist, tapos for some visits, I'm not sure if it's like 4 or 5 visits na the condition is not improving. Doon na nagre-require ng consultation to a doctor. Or if the physical therapist thinks na merong underlying or may iba pang reason kung bakit may nangyayari dito sa pasyente, of course, we would refer them to a doctor. Kasi yun nga, obligation din namin na not just treat the patient, but to make sure that everything is working just fine. Dito kasi, we have the ability to recognize or we have mas maano kami dito, mas may binibigyan ng freedom to classify or diagnose. Meron kami PT diagnosis dito that would say that ito yung nararamdaman mo, ito yung meron kang mechanical low back pain. Ganyan. So, but if at evaluation or after a series of visits, tapos na-determine namin, baka this is not just low back pain but something else, then we refer you to a certain doctor that we would think na mas makakaalam or mas makaka-determine na ng cause ng low back pain niya, for example. So yun. So yun yung difference, I guess, with the practice here in the US and the Philippines in terms of how you would see how we see patients or how patients can come to physical therapists.
I see. Then, mentioning those differences, again, I'm not sure if this is a valid question, pero which is more efficient? Ano yung mas efficient na method na yun nga, since dito nga required nga kailangan ng parang may approval muna from the doctor para magpunta sa isang physical therapist. Ano yung parang mas effective or mas efficient?
That's a very valid question. I think there were already studies na nagsasabing very efficient if patients would have direct access to their physical therapists. I think it was a study in somewhere in Europe that or Europe or Australia. Anyway, there was a study that said that in terms of musculoskeletal condition, meaning bones or muscles, physical therapists are second to orthopedic doctors that could, identify those conditions. So, ibig sabihin, next to orthopedic doctors, kami yung mas nakakaalam ng mga nangyayari sa buto mo, sa muscles mo, and generally in terms of pain. So, I would say in terms of cost sa gastusin mo and sa gastusin ng insurance, mas efficient pag si patient ay makakakita ng physical therapist directly. Kasi pwede naman yung some conditions pwede nang ma-address ng physical therapists directly with our interventions. Siguro yun ang dream ng mga physical therapists sa Philippines, na may access yung mga pasyente to a physical therapist directly. Kasi sa Philippines, hindi naman lahat may insurance eh. Hindi naman lahat may HMO. Hindi naman lahat may may tinagong pera para sa kalusugan nila, para mag-doktor, bayad ka ng doktor, tapos bayad ka ng physical therapist. Kung tinanggal mo na yung visit from the doctor at nakita ka na ng physical therapist at kaya naman palang ma-address ng physical therapist yung hinanaing mo at condition mo, then nakatipid ka na. So, it saves you the trip to the doctor, it saves you the money that you pay to the doctor, and it saves you the siguro stress and anxiety from seeing different professionals. Di ba sa HMO, sa HMO, di ba, you have to go to their doctor first. Then, yung doctor na yan may refer you to a different doctor and refer you to another doctor. You do this tests, MRI, CT scan, or whatever, or X-ray. Tapos saka ka palang i-refer sa physical therapist. Kung nakita ka na ng physical therapist muna, tapos na-determine ng physical therapist na, okay, this is your condition and this is how we're gonna treat this. And it saves you all the unnecessary visits to other places. Kasi for physical therapists are trained naman to identify red flags. Physical therapy, red flags yun yung mga delikadong conditions na that we would say na ito kailangan makita ka ng doctor for this. Ito kailangan ka makita ng doctor para dyan. So, yun muna ang dinedetermine namin pag nakikita namin yung mga pasyente. So, unang pasok pa ng pasyente, so dito sa US or just sa Philippines, we do certain tests. So, we interview the patient first, get all their history, siguro, tapos yung past medical history pa nila, kung ano yung mga iba nilang sakit. Tapos, we try to identify red flags that would that would tell us that the condition is coming from another source. So, kung hindi namin sakop kung ano yung nararamdaman mo, bibigyan namin sa doktor na, ito, tingnan nyo muna to. Make sure na safe siya for exercise or for us to treat this person. Kasi we don't want that person to get hurt. So, ganon. So yeah, answering the question again, I guess it's more efficient to see a physical therapist directly. Sana mangyari sa Philippines. We're hoping. Pero it's I think a long battle or a long journey.
Yes, efficiency is the key. So, word of the day, word of the night, efficiency. Yeah.
Efficiency.
Yes. Pahapyaw mo nang na-mention kanina yung tungkol sa muscles and bones, orthopedics in specific. Doon actually umikot yung question ng friend ko. So, I'm not sure if this is a valid question. From Jean Claire Bulahan, hi friend, love you, miss you. So, when do we know if sa PT lalapit or sa ortho? Ortho ata is bones and muscles pa, right? Pakorek na lang po if mali. Yan.
Sa context ng Philippines, you really have to see your doctor first. So, yun ang masasagot ko. Sa context ng Philippines, you would certainly go to a doctor first. So so ortho and PT, of course, pag nasa Philippines ka, punta ka muna sa ortho. Then ortho would refer you to physical therapists. In places na merong direct access, patients or individuals with pain, musculoskeletal pain, or pain in general, would go to physical therapists first. Kasi physical therapists are known for that eh. Pag may masakit sa'yo, punta ka sa PT. Then the PT would identify, kami para magta-triage, kami magsasabi kung kailangan mong kumita ng ortho, kailangan mong kumita ng ganitong doctor, neuro, or kailangan mong kumita ng cardio pala. So, dito sa amin, pag sa mga outpatient, individuals can go to physical therapists first pag may masakit ka sa muscles or bones. Yan. Sa Philippines, as I've said, context ng law, you would go to ortho.
I see. So,
Pero in terms of, kunwari, in terms of pain, pwede ka pumunta sa ortho, pwede ka rin pumunta sa rehab medicine doctor or sa physiatrist. Or kung alam mong meron kang arthritis, pwede ka rin pumunta sa rheumatologists. So they share scope in terms of pain. Yun nga eh. So yun nga ang medyo mahirap pag wala kang direct access sa physical therapist. You're left thinking, anong doktor ba ang kailangan kong kitain pag ganito? Di ba? Pag may masakit sa akin, pupunta ba ako sa ortho? Pupunta ba ako sa rehab med? Pupunta ba ako sa arthritis doctor? Pupunta ba ako sa neuro or something like that? So, pwedeng puntahan mo lahat. Di ba? Or pwedeng puntahan mo muna yung PT, sabihin ng PT sa'yo, I think that we can address that. So, di ba? Na-cut na yung anxiety mo sa kakaisip kung sino pupuntahan mo. Kung pain, kung may masakit lang sa'yo, ayoko sabihin lang kasi maraming nakaka-encounter ng chronic pain na hindi naman talaga biro. Pero pag may complain ka ng pain at may direct access yung lugar mo, edi nahinto na yung agam-aga mo in other stuff, thinking about kung sino pupuntahan mo, di ba? So I hope I answered the question of your friend.
Yes, nasagot naman, Johan. So thank you so much for that. So kanina din pahapya mo rin na mention yung mga ilang conditions na pwedeng maaring i-treat by a PT. Can we just emphasize it for this time lang? Kung ano yung mga conditions and even mga conditions na hindi natin inaakala na pwede pala siyang matreat ng isang physical therapist.
Okay. Actually marami physical therapists would have the scope from prevention to rehab or maintenance. So doon pa lang marami ka ng pwedeng conditions na makita. Siguro health prevention, prevention, yung mga tao na wala pang sakit at gustong manatiling walang sakit. Sila siguro yung mga healthy individuals na would like to stay fit and healthy. Rehabilitation, sila ito na yung may mga conditions din sa question mo. Ano yung mga merong conditions na gusto nilang mapabuti, mapalakas yung sarili nila. Maintenance phase, maintenance areas naman, sila naman yung may chronic conditions, let's say heart conditions, lung conditions, or other metabolic conditions na they wanna stay healthy the way they are kahit na meron silang mga underlying conditions like high blood pressure, diabetes, or COPD, asthma, mga ganyan. So yun, so yung scope from prevention to maintenance mahaba na. Tapos sa spectrum naman ng age, from pediatrics to geriatric, from bata hanggang matanda, kinikita na ng mga physical therapists. So let's go sa pediatrics. Marami you would have cerebral palsy, you have kids with autism, kids with Down syndrome, any types of developmental delay, physical therapist would, hindi siya rehab but habilitation, which is trying to help the kids achieve their milestones. No, they have like, pwede sila kasi magkaroon ng delay in function sa mga galaw kasi we normally have as individuals, we normally have milestones that we reach pag habang tumatanda tayo from 0 to 6 months, 3 months, ganyan, 12, ganyan. Meron tayong ma-achieve eh. Pero for kids na merong developmental delay, physical therapists would help that, help them achieve that. Even autism spectrum, Down syndrome, nakakatulong dun yung physical therapists to achieve better function, makatulong sa kanilang paggalaw sa school, maging safe sa bahay, so yung mga ganon. Then as we get older, your normal conditions like your sports injuries, chronic pain, acute pain, so for yung mga musculoskeletal, mga neck pain, low back pain, shoulder pain, knee pain, foot pain, so pain generally nakikita ng mga physical therapists yun. Arthritis, tinitingnan ng physical therapist as like in acute flare-ups and maintenance. Marami pa eh. And in terms of cardiopulmonary, heart and lungs, heart problems, hypertension, people who had heart surgery, mga bypass, mga valve replacements, those people who have cardiomegaly, yung mga lumaki yung puso, in terms of lungs, mga people who have bronchitis, COPD, asthma, emphysema. Tapos as you get older, yung mga frailty, geriatric syndrome, post-operative hip replacement, knee replacement, shoulder replacement, falls, balance, dizziness. So actually pwedeng lahat eh kasi kahit cancer, post-cancer, before cancer, during cancer, nakikita din ng mga PTs eh. Even sexual health, pwedeng kitain ng physical therapist. Erectile dysfunction, sexual dysfunction, pwede rin kitain ng physical therapists. People who are in their deathbed, palliative care, kinikita din ng physical therapists. So, sa spectrum ng lifetime ng isang tao, pwede silang makakita ng isang physical therapist in terms of their health naman, from healthy to maintenance, pwede rin silang kumita ng physical therapist. So ang scope ng physical therapist napakalawak. Conditions ng nakikita ng physical therapist napakalawak. Ibig sabihin, pinagtatrabahuhan ng physical therapist napakalawak din, from schools to hospitals to home to nursing homes to assisted living, independent living facilities, community. So yun, ang daming pwedeng puntahan ng physical therapist. So maraming areas and settings and expertise and specializations ang isang physical therapist.
I see. With all that scope, all throughout this discussion that we're having, there's this question. I want to apologize in advance if this may sound stupid, pero I want to know not really the what, but the why behind this question. So, oh my gosh, nakahiya itanong. Pero, allowed bang magreseta ang isang physical therapist?
Valid question naman siya. Hindi naman siya, stupid question. Philippines, hindi. Reseta ng gamot? Hindi. Kasi doctors lang ang may nun. Kahit pala sa US, hindi pwede magreseta ng gamot ang physical therapists. Reseta ng exercise, oo, pwede. Meron kaming exercise prescriptions. So, we would say na exercise is your medicine in terms of physical therapy. Pero gamot, hindi. Um, reseta ng or referral siguro ng imaging dito sa US, ibang physical therapist sa ibang states pwede na magsabi na kailangan mo ng x-ray o kailangan ng MRI. So yun, pwede naming ipagawa or yan, gawin. Pero yun na, paggamot hindi sakop ng physical therapist.
Mhm. I see. Okay. At least malinaw sa akin. So, thank you for clarifying that question. And, yun nga, sobrang lawak ng scope ng inyong profession. And, syempre, it's nice to share that knowledge to everyone, especially sa field ninyo. Dito na papasok yung inyong podcast, which is PT Meal. Maaari mo bang i-describe sa amin kung paano nag-start, bakit mo, the whys in producing a podcast, producing PT Meal podcast in specific?
Yeah, kasi naalala ko nung nag-start ako dito sa US, nasa home health ako noon. So lagi akong nagda-drive going to the patient. So meron akong mga 20 minutes going to a patient, 30 minutes drive going to the patient. So I always listen to podcasts. Sabi ko, yung pinapakinggan ko mga physical therapy podcast. Sabi ko, I'm sure there are a lot of physical therapists na Filipinos na pwedeng mag-discuss ng ganito, na pwedeng i-relay sa kapwa namin physical therapist, pwede rin i-relay sa mga Pilipino sa Pinas. So, yun yung bakit ko naisipang mag-podcast is to share physical therapy practices and to share the achievements and that put spotlight on Filipino physical therapists sa kanilang ginagawa in their practice, may it be in the Philippines or the US or kahit saan. So para makatulong sa kapwa ko PT, tsaka sa mga kapwa ko Pilipino. Yan.
Ano yung unforgettable episode or guest na-produce mo so far with, I'm sorry, 5 seasons? 6 seasons?
Currently on the 6th season.
Yan. Currently on the 6th season. Ano yung parang unforgettable na guest? Or pwedeng guests, pwedeng more than one.
Siguro at the top of my head, ang pinaka-unforgettable ko would be my episode with Doc Jojo Saison. He is a physical therapist in NASA. So parang wow, mayroong physical therapist na nagtatrabaho with astronauts, di ba? So parang isa yun sa mga reasons kung bakit ko rin naisipan gumawa ng podcast is to have inspiring stories like that na, if he can do it, so can I, di ba? Parang tapos magugulat ka na, pwede palang gawin yun. So paano niya ginawa yun? Kaya ko bang gawin yun? So yung ganon. So very inspiring yung story niya of being involved in a NASA project. Tapos a lot of my guests, all of my guests naman are very inspiring. Kaya ko naman sila in-invite sa podcast. They share their stories, their successes, their failures, para us, including me and the listeners, would learn something from that. So we learn from their expertise, ano yung mga ginagawa nila, ano yung kagalingan nila, kung saan sila nagbihasa, tapos kung ano yung mga experience nila going there, ano pa ba, yung mga gusto ko yung mga unique experiences like that, like NASA. And I also had Miss Lily Wells, Dr. Lily Wells. Sa kanya naman, she talked about pelvic health. So parang tayo, us physical therapists would, are surprised na, pwede pala ako pumasok sa pelvic health. Pelvic health, yun yung down there, yung private parts mo. Parang mga Pilipino would shy away from that kasi napaka-modest natin as individuals . Pero physical therapist can help you with that. So sa mga babae, post-pregnancy, while perinatal and before perinatal and postpartum, pwede silang kapitan ng physical therapist. Tapos if you have like incontinence, diba? Magugulat ka na pwede palang kitain ng physical therapist yun eh. So yun yung mga siguro unforgettable and tumatak na mga ano sa akin. Aside from the others, syempre they all have their stories and advocacies and expertise to tell. Kaya nga each season, each episode would present a different topic para makita ng mga mapakinggan ng mga tao na there's a lot of things physical therapists can do for the patients and physical therapists can strive for in their career and their profession. So yun.
I see. Alright. Okay. Ano pa yung mga future plans mo for PT Meal Podcast? Like, is there any what do you call this? Is there any guest na na-imagine mo or na-envision mo na gusto ko siyang makuhang guest someday? Ganun.
Mm-hmm. Marami pang topic na hindi pa na napag-uusapan sa PT Meal eh. Siguro focus muna ako on those topics. Sa ngayon I'm still inviting other guests na marami na akong topics na naiisip eh. Pero yun nga, hindi ko pa sila naririnig or hindi pa nakaka-set ng schedule kasi yun yung mahirap eh, setting the schedule and waiting for them to reply. So yun yung struggles ng podcast for me, having guests. Hindi siya katulad ng podcast na you're on your own, na you get to do record by yourself. Pero yun yung pinili ko and yun yung kasing magandang gawin for the topics. Have experts talk about their topics instead of me just talking about certain topics na hindi ko naman expertise. So yun. So the next episode, the coming episode would be about high resistance training for older adults. Meron akong PT na nakausap na ginawa niyang nagbigay siya ng resistance training, strength training sa isang 105-year-old na pasyente niya na nakita niya nag-improve dun sa program niya. So ang galing na 105 years old na binigyan mo pa rin ng high resistance exercise program and that worked for her. So yon, and the following episode would be male practitioner in the pelvic health scene. So lalaking physical therapist na kumikita ng issues about kalalakihan. So kasi dito sa US karamihan ang nagpa-practice ng pelvic floor or ng pelvic health ay mga babae eh. Kasi yun yung market kasi ng karamihan pero bihira lang yung mga nagpa-practice na kalalakihan na kumikita ng mga issues ng mga kalalakihan. So mga erectile dysfunction, incontinence, sexual pain during ejaculation, pain during orgasm, mga ganon. So it's something interesting. So ang mga topics na iniisip ko is something interesting, something new, and something worthwhile to listen to. So yun.
Interesting. Something new, something na taboo na napag-uusapan, diba? So,
oo. Dapat hindi siya taboo eh. Pero since tayo kasi diba parang
nagiging taboo siya sa atin.
Nagiging taboo. Oo, parang iniisip ko nga eh, kung magkakaroon ng pelvic health na practice sa Philippines, magiging successful kaya yon? Pupunta kaya yung mga kalalakihan, kababaihan na may problema sa kanilang private parts sa isang physical therapist para ma-address yon. Pero I hope so. I hope I'm hoping na mawala na yung stigma ng ganun sa Philippines. Mga tao sa Philippines na na kumita ng professional about their private issues.
Yeah, that
Kasi
is
kasi hindi lang, I mean, pwede naman siya ma-address eh. You don't have to live your life thinking na this must be normal, you know. Kahit naman yung healthy individuals, pag-usapan namin ng mga physical therapists, kahit naman healthy individuals nagkakaroon ng problem sa kanilang privates, like common issues pala sa power lifters na weak yung pelvic floor nila, yung parang pagbuhat nilang ganon, bigla silang parang maiihi ng konti. So iniisip nila normal yun, pero hindi siya normal. So those healthy individuals can benefit from seeing a pelvic floor physical therapist. So very interesting. So not just for physical therapists, but for the audience, the general audience who might be, listen to the podcast.
wow. Sa mga kasama ko sa creative industry, nosebleed na ba kayo? Hindi. Pero, yeah, I mean, I like the way you discussed it. To someone like me na, oo nga no, pwede nga pala. I mean, yeah, it made sense. So, thank you. Thank you for sharing those thoughts. Especially sa amin na yun nga, hindi namin industry yun. So, thank you for sharing. But, this is not yet the end because magpapas muna tayo for tonight. So, hindi pa tayo tapos. Kasama pa rin natin si Johann Dela Paz dito sa KaTalk. We'll be right back. So, it's April 17, 11:16 p.m. Balik tayo at around 5 minutes. So, okay, bilang na naman tayo ng daliri. 16, 17, 18, 19, 20, 21. Sige, kahit 11:22, balik tayo pa sa 5 minutes. So, yes, we will be back. So, this is KaTalk. Pinik to talaga. We'll be right back. Ayun. Hi guys! Welcome back sa ating huling stretch ng ating kwentuhan tonight. This is KaTalk. Kasama pa rin natin si Johann Dela Paz ng PT Meal Physical Therapy Podcast at live pa rin tayong napapanood sa ating Facebook page na streamed Siomai. Yes, may mga ilang nagpapa-shoutout sa atin dito. So, Johann, please go ahead. Shoutout po sila.
Shoutout sa friends ko from Salisbury, Maryland. Kay Rai, kay Mike Q, Mike R, tapos kay Lani na nasa, I think, Florida ngayon. Ayan. And para sa mga friends ko rin from Massachusetts. Si Levin tsaka si Joy. I think they're listening to, watching.
Ayun, guys, thank you so much for listening, for watching our show for tonight. So, it means a lot to us content creators na, especially that when we started creating our own content, it's just nice to have this support when you encounter someone who's producing content. So, sige, I will also like it, we'll also share it, we'll also listen to it, ganyan. So, let's just keep on doing ourselves, ganyan. So, yeah, let's go back to our conversation. So, just like my previous guests, sa last stretch ng program, pinag-uusapan natin yung life after or even during the pandemic. Knowing that you are in California, so medyo iibahin ko yung question. What are your thoughts on the pandemic and yung mga bagay na nami-miss mo and gusto mong gawin pero you just can't do it because of the pandemic?
Well, thoughts sa pandemic. Well, it really took us by surprise. I was working in a skilled nursing facility noon nung it hit yung tipong lockdown talaga. Parang yung skilled nursing facility kasi namin meron ding long term, so yung mga residents doon matagal nang nandoon. And before pandemic, maraming mga relatives bumibisita doon sa mga pasyente. Pupunta sa sa rooms nila, nagdadala ng food, pag-usap, ganyan. Pero after the pandemic, during the pandemic, nung nag-lockdown na, bawal na silang pumunta, Tapos nag-limit na and nag-restrict na ng visitors. Tapos I think doon na nag-start ng downhill ng mga ng mga residents na very big thing sa kanila yung makakita ng relatives Parang mas nanghina sila after that nung hindi nila nakikita yung mga kamag-anak nila. Parang it's sad to see them decline dahil doon. So yun yung I guess pinakamalaking impact ng pandemic doon sa pinagtatrabaho ko back then. Tapos naging na kami noon naging natataranta na kami kasi parang napupuno na yung mga hospitals. Tapos ang ending noon ang plano na kasi after nila maging stable, ibibigay na sa bagsak na noon sa skilled nursing facilities so pwede kaming maka-receive ng patients na post-COVID. Back then, hindi pa natin little research pa yung meron So parang kami, anong mangyayari? Kailangan ba namin ng isolation? Kailangan ba ng training? Sino yung magiging staff para doon? So parang yun yung mga agam-agam sabi ko nun, may incentive naman. May financial incentive pag ikaw yung mapupunta doon ikaw yung magtitreat ng mga COVID patients. Sabi ko, sige, okay na lang. Volunteer ako na lang. Tapos, meron nag-set up sila ng mga special rooms para doon lang yung receiving area And, so, we prepared, pero parang sa matagal na preparation namin, hindi kami naka-receive ng COVID patients nung nandun ako sa trabaho na yung previous job. Ngayon, sa current work ko, sa hospital, ganun pa rin yung protocol You have to wear your surgical mask, then your face shield, and your gloves if you're gonna have a direct patient care pagkahawak ng mga pasyente mo. Tsaka pag malapit ka like less than 6 feet. Pag physical therapist ka, hindi ka naman pwedeng ang layo-layo mo sa pasyente. Nandun yung pasyente, tapos ikaw nandito ka lang Ano pang silbi mo? Pwede naman. Pero, I mean, doon sa pinagtrabahoan ko, parang it's not that setting na pwedeng malayo So, yeah. I guess, ngayon, yung current situation ngayon, nag-i-improve na dito sa California. Since nagkaroon na kami ng vaccines, nabigyan na kami ng vaccines January pa lang, nag-roll out na yung vaccines. Second dose namin February. So, kami sa amin, ang priority dito sa California, healthcare workers and those who are treating COVID patients. Tapos, after naming makakuha, yung mga pasyente naman namin that agreed for the vaccines also got theirs. So yeah, so ngayon, yung sa pinagtrabahoan ko, slowly, we are opening it up again. Kasi dati, the patients and the residents are just staying in their units, in their separate units para walang cross-contamination. Pero ngayon, they're opening it up again. So, getting back to normalcy, I think normal would go back as soon as we see that there is no one getting infected again. So, hopeful for that that time. Pero dito sa area namin, general area, the restaurants are opening up again na indoor dining is okay. Ibang parts ng US pwede nang pumasok sa sinihan. Well, outdoors naman hindi naman pinagbawal before So yun, may sense of normalcy na in a lot of areas na medyo nakakaawa sa Philippines.
True, mapapasana all ka na lang. I wanna ask your experience regarding dun sa vaccination rollout. But before that, merong nag-comment sa atin sa Facebook. So, Justin Ong is asking if may recommended exercise for dextro and okay, I'm sorry, baka mali yung magiging pagbigkas ko dito, but levo or levoscolio for back pains. So, yan. Yun yung question niya.
Ah, okay. Mahirap kasi mag-specify ng exact exercise for a certain condition na hindi ko naman na-assess. I would say na there are specific exercises, pero ang general that I would recommend is to promote flexibility. Be active and do stretches. Pero specifically for dextro and levoscoliosis, I would suggest you see a physical therapist, or your doctor first, and then refer you to physical therapist para that physical therapist can give you a specific tailored exercise for you. Ang essential kasi for scoliosis is maintaining flexibility on your spine and maintaining physical activity. Yun yung general na pwede kong sabihin. Pero specific exercises for that condition, I would defer that to the consult and professional advice of your specific physical therapist.
All right. Ayun. Thank you for answering that question. I hope naging okay yung I hope na answer yung question nyo, mo, Justin. Thank you so much for dropping your comment. So, yun nga, talking about yung vaccination rollout there, kumusta yung naging experience mo and experience in general there? Like, how was it smooth? Was there order? Kumusta yung parang, was there some sort of a strategy or was it planned well in your perspective based sa experience mo?
Sa experience ko, I could only say dun sa hospital na pinagtrabahohan ko, before the rollout, we're updated kung ano yung plan ng hospital. Kailan dadating yung vaccine, anong klaseng vaccine, tsaka ano yung studies that are backing up the vaccine. Kasi I think there is doubt siguro or uncertainty sa vaccines. With anything new naman, merong ganong feeling. Pero the hospital itself was answering frequently asked questions. Ano yung vaccine? Ano yung ibibigay sa atin? Kailan dadating yung vaccine? Ano yung magiging effect ng vaccine? Ano yung studies na ilabas na about that vaccine? Ano yung choices na pwede namin i-take in terms of the vaccine? So, I guess with that strategy, na-appease naman yung mga agam-agam or the skepticism of some people. The goal, I think, for the hospital or any other institution is to get as much people vaccinated as possible. So there are people who would opt out to get the vaccine, and I guess that's their choice. But the goal was to really have everyone get the vaccine, if not most of the residents and the staff get the vaccine. Yun, maganda naman transition. They were very organized. At first, they have a scheduling system na kung sino muna yung high priority are the people who would directly get access to the patients or the residents. Kung sino yung nakikipag-interact sa mga pasyente, sila muna ang binibigyan ng vaccine. Kasi in an institution na closed, syempre yung the virus would come from outside, meaning from the staff that goes in and out of the hospital. So everyone who's directly in contact with the patients, sila muna yung prioritize. So ako, nurses, doctors, psych techs, so sila muna yung pinauna. So scheduling, ganyan. Tapos nung medyo bumagal yung scheduling, pero marami pang supply, inopen nila yung mga walk-ins para kahit sinong gusto na, kahit wala sila sa schedule, makapag-take na ng vaccine. So, tapos, yun nga, tuloy-tuloy pa rin yung updates of cases, tuloy-tuloy updates of the vaccines, ano na yung nangyayari, rollout, how many people are vaccinated. So, sa amin, organized siya. I would say very organized yung pagkaka-roll out ng vaccines and very prompt kasi nung sinabi pa lang ng California na okay, we're getting ready to roll out the vaccines sa mga major hospitals and stuff, na parang dumadating na rin yung information sa amin na okay, marireceive na ng hospital natin yung vaccines from the state and the county. So ito na yung mga mangyayari next. Ito na yung mga pwede nyo itanong. Ganyan. So yun. Tsaka that time, nung mga bago-bago pa yung COVID, every day or halos every day may report ang California governor, may report ang LA mayor kung ano na yung mga plano. So you're not left out in the loop, so to speak. So ayun, so parang comparing that to the response sa Philippines, parang medyo I don't know what.
Papasana all ka na lang. Ay. Yeah, so dito sa Pilipinas kasi, yun nga, meron kaming health protocols na sinusunod, and that includes, eto medyo, yun nga, like, nagkakaroon din ng problema kasi nga, every LGU is doing it, pero the national government really wants a unified contact tracing application. Sa California ba, like now that you mentioned na there are signs of life. Signs of life! But yes, there are signs of life that are already showing, that are appearing in your area. May mga, ano yung mga certain COVID protocols pa yung sinusunod ninyo kahit may sense of normalcy na kayong na nafe-feel, na-experience there?
Yung physical distancing, ganun pa rin. If you're out in the public and for example in the community, nasa grocery ka, we still wear masks, we still practice physical distancing. Some people don't wear masks because they said they don't believe in it, pero I won't get there. I won't go there. Pero yun, so yung pa rin yung mga hand washing, of course, marami pa rin establishments na merong hand sanitizers. Tapos, ano ba? Generally, yun mo lang eh. Yun lang ang nakikita kong protocols that still follow. Physical distancing, hand washing, masks.
Walang parang contact tracing na nangyayari na you have to register if you enter a certain establishment. Wala nang ganon.
Wala akong experience na ganon. Sa hospital namin, yes. Like for example, I go to a certain unit, I would log my name in case na there would be cases, kami yung itetest. Pero sa outside the institution, wala.
I see. And before tayo nag-live, yun nga, kasi nakita ko yung isang video mo. Although, sorry, paspasan ko na lang siyang pinanood. Yun nga, tungkol dun sa pag-fit ng N95 mask. So, actually, doon ko lang nalaman na, finifit pala ang N95 mask. Can you share to us your experience and bakit kailangan i-fit ang N95 mask?
So, yung N95 mask, di ba, yun yung mas nakaka-filter ng mga smaller particles, di ba? Yun yung naging issue siya before, di ba? Na ibigay natin siya sa mga healthcare workers kasi sila yung mas nakakailangan. So, N95 mask, kailangan siyang i-fit kasi kailangan pag suot mo ng mask, sealed yung buong area. So, from here tapos hanggang pababa, hanggang sa ilalim ng chin mo, dapat nakaseal siya. Tapos, in order to do that, dapat wala kang facial hair. So, that time, tamad ako mag-ahit. Punong-puno ako ng, ayan, parang ganito. Mas balbasin ako before. Tapos, there are allowed facial hairs na per CDC or CDC guidelines or World Health Organization guidelines. Kung ano lang yung pwede mong facial hair na pwede. So pwede ka lang magbigote. Bawal ka magbalbas kasi kailangan sealed off dito. So kailangan mag-ahit. Ayoko naman nakabigote lang ako, mukha akong yung 90s rapist. So, joke lang. yung mga so nag-ahit ako kasi when you test N95, you wear the N95, you seal it for yourself, check mo yung lahat ng in contact, tapos you wear headpiece na para sa dito, tapos may butas doon na sprayan ka ng solution. I think the instructor said na matamis daw yun eh. So pag in-sprayan ka, tapos you breathe in, tapos nalasahan mo yung, or naamoy mo, nalasahan mo yung ibig sabihin hindi sealed yung pagkakasuot mo ng N95. So kailangan talaga i-fit mo siya sa'yo na parang feeling may vacuum. So yun. So she would do that like 3 times. Tapos para matest talaga na walang pumapasok na air from outside dun sa nicks and crannies ng mga ng N95 mo. Yan.
May ganun pala.
Oo, especially kasi for infectious diseases, mas N95 yung pinapagamit sa amin. Nung bago-bago pa, yung sobrang wala pa tayo masyadong alam sa sa COVID, N95 yung recommended for us. Those who are spending more time with patients na very close contact aside from the face shield. Meron kaming N95 for double protection na rin. So yun, tapos nung getting more lax, surgical mask okay na.
I see. So, yun nga, earlier na pag-usapan natin yung sa vaccine. So, medyo isisingit ko na rin at wala to sa questionnaire. Pero yun, syempre, I'm sure nabalitaan mo before na yun nga, kasagsagan nung Dengvaxia scare. So, dahil doon, nagkaroon ng agam-agam yung mga tao sa pagbabakuna. Ngayon, na nandito na, sa Pilipinas, nandito na tayo sa phase na nagsisimula na ngang i-roll out yung mga vaccines. Although, yun nga, iba, incoming pa lang, pending pa. Syempre, parang before nag-roll out yung vaccines dito, syempre, nag-usap-usapan yung mga clinical trials. Ito medyo, hindi naman risky. More on, ito yung ginagawang basehan pag nakikita ko sa feed sa social media na parang, ganito lang efficacy rate ng isang vaccine. So, syempre, yung sikat dito sa Pilipinas, hindi ko na babanggatin ko ano yan. Pero, yun yan, nakita nila na mababa lang yung efficacy rate. And, thankfully, nung in-upload ni Vox, yung kanilang animated explainer regarding sa vaccines and clinical trials, it made sense na parang, yun yan, nagva-vary nga kasi sa clinical trials yung mga bakuna and hindi talaga sole basis dapat yung efficacy rate na yun yan, na-report ng vaccine makers. Ano yung, with that, ano yung maaari mong maipayo to those, let's say na yun nga, mga frontliners and, or even yung mga nagko-consider na mga senior citizens, ngayon mga nasa, I believe it's category A3 already, and some of them might be hesitant in getting the vaccine. What are your thoughts on that, and how would you convince people, at least Filipinos, to get a vaccine?
Ano yung categories?
Oh my gosh. Ngayon kasi
what's that for? Kung sino yung makakuha ng vaccines?
Kasi dito ngayon sa Pilipinas, ang kasalukuyan na pwede nang kumuha ng vaccine is under A3. So, ay, wait, A3. So, that includes, wait lang, sige. Total, naka-live naman tayo. I-research natin yan. So, wait lang. COVID,
Ay, so,
yung
yung question is
categories. Yes,
kung sino yung priority.
I believe na tapos na yun yan, nagawa na yung sa medical frontliners, then sa senior citizens, and then ngayon sa mga ano ba yun? I am not really particular with the term, so hindi ko na babanggitin, mali pa yung masasabi ko, pero yun nga, I think ready na yata sila mag-roll out with yung vaccine to those who are already, let's say, working in the construction, na nasa government. So, basically, mga essential workers, essential workers na yung alam kong next in line na bibigyan na ng bakuna na ipaprioritize na ng national government.
Medyo mabigat yung question kasi I don't think I'm someone to recommend or advise something like that. Pero coming from a personal experience and personal belief, I'm not answering in terms of my profession and my organization. Siguro, I would say na kasi may aspect na kung ano yung meron, get that just for the sake of having that line of protection against symptoms. I would say it's better than none. Hindi naman natin nakita, I think wala pa namang sobrang reported dun sa lower efficacies na sobrang adverse effects. So I would think it's still safer than none. And siguro kung may choice ang mga tao, I would say, well, sa relatives ko, I would say doon sana tayo doon sa sa higher efficacy, but I mean kung ano yung na-offer, I would say just get it. Sa family ko, I'm not like telling other people that. I think there's a question before sa akin. I mean, tanong sa groups ng mga friends ko, tinanong pwede bang i-mix yung lower efficacy vaccine to a higher efficacy na vaccine. Tapos, I think they're studying that already. May mga pag-aaral na about that. Kung yung first dose mo ba ay ito, tapos pwede ko bang kunin na yung second dose ganito. They're studying that. I think sa ibang vaccines, pwede yon. Pero so far, hindi pa napag-aaralan yun with COVID-19 vaccines. At ongoing pa lang siya. Mahirap magsabi ng advice. I would say if it feels comfortable for you, if you have understood all that is there to read about the vaccine that you're taking, if it's accessible, if it's there, I would say, and you feel comfortable taking it and you feel it's safe, then I would say go for it. Studies are still ongoing. Malay natin pwede maging parang pneumonia vaccine to na kailangan nating i-take every 5 years, or flu vaccine na kailangan i-take every year. We don't know yet. So siguro for now, probably take what you can.
Yes. Alright,
Yeah.
sige. Oh my gosh, ang bigat pala ng tanong ko.
Oh,
I am
medyo.
so sorry. I'm so
Kasi
sorry.
di ba meron marami parang agam with other people, and it's hard to say something like that na hindi ko naman siya expertise. If it's coming from an infectious disease doctor or siguro virologist, siguro mas makakasabi sila ng mas magandang advice. Pero I'm just coming from my personal take on that. Siguro.
Yeah.
So, ayun.
Yeah, very understandable, of course naman. So guys, hindi po to medical show.
No, and it's not a medical advice. So, ito lang, it's just my experience. So, don't take my word for it. Seek advice from your doctor and research for yourself as well.
Yes, definitely. O sige, yung susunod kong itatanong hindi na ganong kabigat, pero it's still serious kasi yun nga, everyone is experiencing the pandemic. So, ano yung maaari mong ipayo sa mga tao? Siguro gawin na lang natin na to people who are in your industry, who are having a hard time coping in these trying times. Ano yung pwede mong i-share or pwede mong ibigay na tip? Ganyan.
Well, to my fellow physical therapists, I guess one is make sure to take care of yourself, mentally and physically, emotionally. Madaling ma-burn out in these trying times with all these uncertainties. Maraming nakawala ng trabaho. And siguro let's be hopeful that things might get back to normal or at least close to normal soon. Siguro kasi dahil sa pandemic, I think even yung board exam namin, ang daming beses na delay na postpone. Sabi ko, kawawa naman yung mga kakagraduate na hindi makapag-take ng exam. Sobrang tagal na nilang naghihintay. I think even the graduates from last year hindi pa nakapag-take ng board exam. So I would say stay strong, pero ang hirap kasi I'm not in your shoes. Ang hirap nung ganong feeling na nag-aral ka, nag-review ka for a long time. At may drum roll.
Motor. May motor na umano sa likod. May dumang motor. Narinig pala, oh my gosh.
Ba't may drum roll? Akala ko, may sasabihin ba ako bigano may drum roll?
Oh my God. Narinig pala.
So, yeah.
Okay lang.
So, yun. So, just take care of yourself. Kung nagtatrabaho ka, you wear your PPEs, protect yourself, protect your mental health. If you need time to take a break, I would say go out, pero in the Philippines, curfew and dito kasi sa US, kahit nung lockdown and curfew, people are still allowed to go outdoors kasi that's for your physical health and when your mental health Pero I don't know. I don't wanna comment. Maintain your sanity in whatever way that you can. I also do sa mga hindi physical therapist, I would advise na try to maintain some sense of physical activity as well kasi studies have shown na sobrang bumaba ang physical activity ng mga tao as compared to this time before COVID, and physical inactivity is one of the greatest pandemic as well na hindi natin napapansin aside from this pandemic and obesity. So, mas lalong naging inactive ang mga tao, and as physical therapist, I would advise everyone to maintain some sense of physical activity, at least 30 minutes 3 times a week. So recommended is moderate activity, level of activity, 30 minutes 3 times a week kasi advisable is 150 minutes a week for a normal individual. So yun, jog in place, jumping jacks, go up and down your stairs, walk around the house. Kung malakas ka, do burpees, do push-ups.
Kapagod mag-burpees, guys. Ako na nagsasabi sa inyo, pero saya siya.
Ayoko rin nun, pero na-advise ko na sa inyo, pero hindi ko na sinasabing ginagawa ko.
Yeah.
So yun, yun na siguro ma-advise ko sa mga colleagues ko and to everyone who's listening. um, for your mental and your physical health.
Yes. Yes. I agree to that. Kaya, ayun, gusto ko lang din i-emphasize yung sinabi ng previous guest ko last Saturday na yun nga, dito nga sa Pilipinas, we really can't go out. Hindi nga sanay ikulong ang tao dahil we are social creatures. So, kakaiba nga sa, well, at least sa amin dito sa Pilipinas, na yun nga, na the idea or the concept of na ikulong ka sa loob ng bahay dahil, yun nga, wala, kailangan talaga eh. So, kailangan sumunod. But yes, I totally agree to that tip na, yun nga, may physical activity. And, yun nga, since nag-start nga yung lockdown dito, umusbong din yung mga home workouts na nasa YouTube. So,
Totoo.
like, kahit yung mga previous videos na na-upload before the pandemic, biglang nag-boom. Daming, ako, ulit-ulit ko siyang napanood at ginagawa. So, mga 30-minute workouts, ganyan. So, yes, totally advisable siyang gawin kahit feeling mo challenging. So, tuloy lang.
Marami rin naman nakakita ng other avenues to work like for physical therapists and other rehab professionals like OTs and speech language pathologists. Nakakita rin ng ibang avenue during the pandemic, which is telerehabilitation. So ito yung patients would consult with their physical therapists through like Zoom or FaceTime or whatever for their concerns, kasi pwede rin naman magbigay ng tawag dito ng appropriate treatment ang physical therapists and education through this means. So I guess nakakaisip pa rin tayo ng mga iba't ibang avenues to be productive, just like that yung sa exercises, home workouts. And ayun, na nagkasarado yung ibang doors pero may nag-open din. So hopefully after all this, we get to merge both practices and thrive again.
Yes, I agree to that. Nung sa first gap natin, yun nga, pinag-usapan natin, yun nga, yung tungkol nga sa pagtatrabaho abroad. So, I guess, and na-mention mo rin actually kanina nung first part. So, it would be nice to emphasize lang, at least, yun, part din ng ating parting message na kung ano yung maipapayo nyo sa mga physical therapists na nagbabalak mang ibang bansa.
Okay. Siguro if you're planning to go to other countries to work, make sure to research everything first. Kasi meron namang, I think there are two routes. It's either you do things on your own, with your own money, with your own time, with your own efforts, or go to an agency to help you do that all. Meron akong podcast episodes about that. If you're going to the agency route, I would suggest na tawag dito, research the agency. Punta, type nyo sa Google yung name ng agency, then reviews. Tignan nyo yung makikita nyo na sinasabi ng ibang tao. If it's too perfect, maghinala kayo. Pag makikita mo 5 stars lahat, medyo maghinala kayo kasi no one can be that perfect. Tapos pag nakakita na rin kayo ng mga tipong red or 2 stars, 1 star, medyo na rin kayo doon, maghinala na rin kayo kasi all 5s, tapos makakita ka ng 2, 1 star, parang medyo hindi ka panipaniwala yung mga 5 stars pag gano'n na. Ito rin kasi medyo ko doon kasi recently may mga nagtanong sa Facebook groups ng mga physical therapists na about this certain agency, hindi daw sila nabibigyan hindi daw nagre-reply yung agency sa kanila, tapos wala daw timeline. So ibang-iba siya doon sa experience ko with my agency back then na transparent yung agency ko. Wala akong binayaran sa kanila. Um, I'm talking about the agency that I went to. Wala akong binayaran. Ang binayaran ang labas ko lang ng pera ay doon sa mga documents na kailangan kong i-submit na hindi naman dumadaan sa kanila, dumadaan talaga diretso sa US na yon. So, makikita mo na hindi ka nilalamangan or hindi ka ginugulang kasi transparent sila sa akin with my timeline, with the steps, and with what they are currently doing. So, kung yung mga bagay na yon ay hindi masagot ng agency mo, medyo mag-isip-isip ka na. Tapos, before you sign a contract, make sure that you know people from that agency who were already deployed. Kung nakaalis na ba sila, gano'n sila katagal nagstay sa Pilipinas, ano yung visa na ina-apply ng mga agency para sa kanila. Magtanong kayo kasi nakakalungkot yung mga stories na naririnig ko na mga ganun na hindi sinasabi nila na hindi daw nagre-reply yung mga agency sa kanila pag nag-i-email sa kanila pag natawag daw, nagtatanong ng mga timeline and stuff kung ano na yung current nilang ginagawa for the therapist. So nakakalungkot. Okay naman siguro sa akin kasi okay akong maghintay before ng matagal. Basta malinaw lang sa akin kung ano na yung status ko. So, yun. Advice to those who are planning to go to abroad, to another country to work. Make sure what you're getting is what you deserve. Yung hindi ka babarating sa sweldo or sabihin nila yun kasi yung minimum wage ng physical therapist sa yun kasi yung minimum wage dun sa state na yun. Kung magre-research ka, hindi naman minimum wage ng physical therapist. So yun lang sabihin ko. Tapos yung contracts na very vague, medyo maging rin tayo doon, basahin natin, maging skeptical tayo doon. Make sure that you communicate with your agencies in email para may proof ka so you can defend yourself. No, kasi they should be telling you your timeline and they should be telling you your status, hindi yung ghost ka lang, diba? So, hindi ka naman papayag na ghost ka lang and dami mo ng effort na ginawa. Sabihin nila dapat kung ano yung ginagawa nila for you. So there. And make sure that you ask people who have been there, who went through the process. Kung tama ba yung, kung nga rin, naghintay sila 2 years, 3 years, at least alam mo. Diba? Ako, I waited 2 years before ako nakaalis. So dapat less than that pa pero it was my fault naman kung bakit ako tumagal ng 2 years. Hindi naman. Hindi pala. It's not my fault. Kasi hindi pala ako nabunot sa visa. So, ayun. Pero at least alam ko kung ano yung plano ng agency sa akin. Kung ano yung next steps. May plan A, may plan B. So, yun. So, wag agad-agad maniniwala. Kasi buhay mo yun career mo yun So, ayun.
Yes. Okay, Johan, I'm gonna, before tayo magpaalam, the floor is yours kung ano yung your final message to everyone, friends, family, to your field, and yes, please feel free to promote your podcast. So, the floor is yours. Go.
Those who are still listening, do catch the podcast. It's live in all your podcast apps, Spotify, Apple Podcast, Google Podcast, what else? iHeartRadio, Spreaker, ayan, dami, Overcast, Pocketcast, yan, Anchor. So kung saan ka nakikinig ng mga podcast mo, go there. Marami kayong matututunan, hindi lang physical therapist, pero yung general public, you would have an idea what physical therapists do, anong pwede naming i-treat, saan kami pwede practice at ano yung mga conditions na pwede namin kitain. So, marami rin kayong matututunan. Medyo haba-haba lang ng konti pero I'm sure marami kayong mapupulot doon. Sa kapwa ko physical therapists who are, what would I say? Those who are listening sa podcast, thank you for the support and thank you sa feedback. I have regular listeners and people that I contact or talk to, sina Aga, sina Rain. Thank you for always listening. Those who are new to the podcast, feel free to contact me again if you have contact me if you have any questions or suggestions kung sino yung mga gusto nyo ma-feature din. Okay, so as a profession, we can get through this pandemic. I mean, let's just help each other. Kung siguro may mga taong nawala ng trabaho, we can suggest work, we can just suggest patients that to see. And also, siguro moving forward with our profession, itaas natin yung bandila ng physical therapists. Let's promote our profession, promote awareness. Malaki yung naging dagok ng physical therapy recently about dun sa isang taong that spread some false information. Isang doctor of physical therapy. Yeah, sabihin ba natin mga
Very wrong. Yun na lang.
Very wrong.
Very wrong.
Very wrong. Medyo sumama yung paningin ng mga tao sa physical therapist kasi parang I heard Mo Twister na parang sabi niya, pagkakasabi pa lang niya na physical therapist siya, wala na akong tiwala sa kanya. Parang doon pa lang na parang sabi ko, oh shucks, pumangit na yung paningin ng tao sa physical therapist na, I mean, we're in the healthcare profession, part of the medical team, na saying those wrong, false information na yun ay sobrang laking, I mean, impact for me na parang, hindi naman siya doctor hindi naman siya, well, there's a doctor of it. Kumangit tuloy yung paningin ng tao sa doctor of physical therapy. I mean, it's not a degree in the Philippines, kaya not many people know it. Pero it's still an academic degree. Kahit sabihin na, di ba, meron naman professionals sa Philippines na they got their PhDs somewhere else, their masters from another country, and they still recognize that academic degree. So same as doctor of physical therapy, they got it from a different place, but it's an academic degree. Hindi naman siya mapapractice sa Philippines, pero it's still an academic degree. So parang nakakainis na pumangot yung image ng doctor or physical therapy sa Pilipinas na hindi naman siya doctor, hindi naman siya legit na doctor. So parang I'm taking my doctorate in physical therapy program too. So parang ano ba yan? So yeah, protect our profession. Let's spread awareness. Ano ba ang physical therapist? Ano ba yung pwede natin gawin? At ano yung mga tamang information na magbe-benefit ang mga tao. So, yun ang panlaban natin sa mga ganong tao at sa mga ganong mga pananaw. Kasi as long as we're quiet, they would reign and proliferate. Nasa responsibilities natin yon as physical therapists to combat those information, to spread what is right and accurate. So, yun. I guess yun. For the general public, please still trust physical therapists. Seek physical therapy advice and your medical consult if you need some attention with your general well-being, sa inyong paggalaw, sa inyong pagkilos. For sure makakatulong kami doon as physical therapists. Sabi ko nga, kasi may wala kang sakit, you're healthy and you want to stay healthy, meron kang na-experience currently na condition, we can help you with that. If you have your chronic conditions, hypertension, diabetes, um, other long-term conditions, and you want to maintain your current function or at least stay healthy as long as you can, physical therapists can help you out with that. So yeah, that I guess haba. Sorry.
No, no, no. No,
So
no,
yeah.
no. Actually, it's nice. Thank you for shedding light to that because it's important. Like, yun yan, dahil dito sa bansa natin na yun yung parang ina-umbrella lahat ng people who are working in the medical industry as doktor lang, diba? So, thank you. Thank you for specifying that. Thank you for sharing that insights. And it goes to show na importante nga ang ginagawa at ang tungkulin ng isang physical therapist. So, sana nga, yun yung na mention mo kanina na sana umabot sa punto na pwede nang sumangguni na kaagad sa isang physical therapist, pero dahil nga may sinusundang batas dito sa Pilipinas, kailangan mo nang lumapit sa doktor. So, yes, I actually learned a lot today. Wow. Oh my gosh, we survived. No, but
ang bilis ng oras when you're talking about things.
Yeah, sabi sa inyo, physical therapy 101 to eh. Anyone can sit in. So, sa lahat ng mga sumali, sa mga nag-sit in tonight, thank you so much. And yes, Johann, thank you so much for the insights, for experiences that you have mentioned, you have shared, and also for the night of a chill conversation. I had fun, and akala ko parang okay, student ako na antokin, but no, I didn't feel sleepy. I learned a lot from you, so from your profession. So thank you so much for sharing your thoughts sa ating show. So I hope you had fun as much as I did. So thank you so much.
Thank you then for this opportunity to talk about the profession and what we do for us, a general public. It's a good avenue for people to learn about it.
Yes. Thank you so much ulit. Once again, guys, ang ating guest for tonight, si Johann Dela Paz, isang physical therapist. So, all the way from California of US of USA. Okay, wag na tayong mag-OA dito. So, thank you so much for guesting sa ating third episode ng KaTalk. Maraming salamat. At okay, nandiyan pa rin yung lower third. Ayan, wala na. So, thank you so much, Johann. Thank you. And always stay safe. Yan. And yan. Thank you so much. Ingat.
Thank you, din.
Alright. So, yes. And sa lahat ng nakivibe sa atin tonight, maraming salamat. Join us again next time for another chill na usapan. But before I go, yes, sa mga sumuporta from episode 1 to 3, maraming salamat. I'm still looking for other guests na pwedeng makuha for KaTalk. Pero habang wala muna, we'll be taking a not really short, indefinite hiatus. So short break lang naman yun. Pero yes, we'll take a break muna from KaTalk. And for sure, baka mag-stream din ako for Stream Siomai Live. So if bored kayo, ganyan. So may gusto ko yung i-contribute na content na pwede pag-reactan or any suggestions, feel free to share it lang. Message na lang sa ating Facebook page. So, fb.com/streamsiomai live. So, uulitin ko na lang. For updates and announcements, you can always follow us sa aming Facebook page na Stream Siomai. And again, for the KaTalk highlights, you can watch it sa ating Facebook page and sa Instagram via IGTV. Yeah, IGTV. Nisip ko IGTV. Again, so it's Instagram at Stream Siomai Live. Meron din tayo sa YouTube, so hanapin nyo lang Stream Siomai kasi hindi ko pa rin napapalitan yung ating URL doon. So, again, Facebook, Instagram. So, yun naman yung important channels. So, again, if you are interested in being a guest or if meron kayong naisip na or if you have let's say, close friend who works for a certain industry and you feel like, okay, parang ang gandang may matutunan tayo from him, from her, from anyone, let me know. If we are friends on Facebook, please feel free to message me. Pitch talaga. Nakamove on na ako sa, ayun siya, bakit ko pa pinabanggit yung pitch? But yes, let me know if you have a specific person in mind that we can guest. And yes, we can work that out. But for now, magpapaalam muna tayo. This has been Alren of Stream Siomai Live, and Thank you so much for watching. This is KaTalk. Happy weekend. Time check, 12:15. It's already April 18, 2021. Ingat again. Mataas pa rin yung cases natin ng COVID dito sa Philippines. So, ingat lagi. Follow health and safety protocols and have a great night. Pahinga po tayo. And yes, happy weekend. Enjoy the rest of the weekend. So, see you guys sa next episode ng KaTalk. Bye guys. Thank you.